utilizing the public-private partnership. Ladies and gentlemen, I want us to just give a round of applause for His Excellency, Governor Godwin Obaseki of Edo State.
Thank you very, very much. Let me start first by appreciating all you guys who've organized this forum or this session. I mean, if I tell you, I'm not impressed as, you know, how young Africans can put this sort of event together, I'll be lying. So congratulations. This morning or this afternoon, I'm expected to put together, I'll tell you in 10 minutes what we've achieved in 8 years. So let's see how we'll do it. So if I rush through my presentation, I don't worry. We have 5 minutes and some time later to discuss areas I may not have covered. So this afternoon, I'm expected to talk about how we can grow our continent and how we have, in a little way, done it in Edo State since I became governor. You know the story of Africa. Africa is full of immense potentials. We stand at the intersection of global trade. We have a very young population. You know, we have great economic prospects, huge natural resources, and on and on. It's not new. But I guess what we are trying to put hands around is the paradox of Africa. You know, yes, we have a very young population, very dynamic. It's a blessing, but if we don't manage it right, as we're seeing in many African countries, it's becoming a problem. If we can't find jobs for them and we can engage them. We are beginning to see, in spite of the resources we have, enormous poverty. And we need to navigate this paradox. And for us, I believe that the way to deal with this paradox and grow our continent, first, we must focus on rebuilding our institutions. I mean, we're all here. This has been around for over a century. You know, how many institutions do we have on our continent that we can boldly say we've grown in time? I guess the most important thing we should be focusing on, which we're doing here today, and which makes me really glad, is about human capacity. It's, you know, us humans, us Africans, that will make that change that will require on our continent. We've got to provide infrastructure and ensure that we take advantage of the competitive advantages we have as a people. How have we tried to deal with issues in Edo State? Like I said, Edo is just representative of the continent. Young people, 5 million people, you know, 2/3 of them young, very young, under the age of 30. We're becoming highly urbanized. We have, you know, an average size GDP relative to the rest of the country. We have about 18, 19 million square hectares of farmland, very rich. But, you know, in the context of the world, we're still very poor. So what have we, in the last 7 years, we've tried to grow that $11 billion GDP. Today, it's almost $25 billion. How did we do it? Just focusing, like I said, on institutions, focusing on governments, because we've got to, only governments can help us organize ourselves. We've reformed our civil service by first rebuilding the infrastructure, cleaning the processes, and then digitizing the way government works. So today, from my desktop, there's really no data I want. I mean, most data I want from government is available. But more importantly, we've worked on the human beings, the civil servants, giving them a sense of pride, made them respected, and more importantly, began to understand that they have to be well remunerated. So a few weeks ago, I announced the highest minimum wage in the country. And for me, even that is still inadequate because, as you say, if you pay pennies, what do you get? You get lemons. So big issues around governance are how you manage your fiscal space, how you manage your people, how you manage your fiscal space, and government has the responsibility to do this. So focusing on the bureaucracy is key. Secondly, you've got to, why do you focus on the bureaucracy? Not for the bureaucracy itself, but for the bureaucracy to help people realize their potentials. Government is there, is supposed to work for us, citizens. And to do that, you've got to have clarity that government's role is not to build the economy directly. Government's role is to create the enabling environment to help citizens achieve their goals. So we've emphasized things to do with enabling environment, making sure there's security, peace, and order, that you have seamless ways of collecting fair taxes from citizens, and on and on. And then also repositioning government to carry out its principal function, which is regulatory. Government is not a business person. Government cannot be. Government is indeed very, very bad business. So, but government needs to understand that and step back and create an environment for people to make money. For us, coming from our unfortunate incident of military rule, where the military saw people who had independence, who were either academics or business people, as threats, because they could sponsor coups, they de-emphasized that role of government helping citizens to become rich. And this is real at the core of any growth, any economic growth we expect. The human capacity. It's people that make things happen. So government's responsibility must be to focus on the people. And key to this is education. Almost all governments all over the world say that basic education is free, and in most cases compulsory. But we in Edo, when we came into government, understood that it was not about schooling. Education is just not about schooling. It's about learning. So we decided to deliberately now begin a process where first we had focused on foundational education. And I said, look, if I have 100 naira or $100 to spend on education, I'll spend $40 on foundational education, on basic education. And that's what we've done in the last 7 years. And you can see the transformation in the kids. So the children in our school system today learn at about 70 to 80% of, at the same rate as their peers in Britain or in America. The other thing is education for what? For us, somehow I don't know where we got it wrong. I got to believe that it's education for certificates, education to be employed. But we said no. It can be education for certificates. It's education to make you useful to yourself and to society, to make you to be able to employ yourself and sustain yourself. The other issue we had to focus on was, yes, we got it wrong at some point. We have a generation or two who were not as well educated as they should have been. What do we do with them? We then focused on just remediation, creating vocational opportunities. So when I came in 2016, we had a crisis. We had a human crisis. At some point, the International Office of Migration approached me, I think it was January 2017, and said, do you know that you have over 30,000 young Edo boys and girls in Libya trying to cross over to Europe? I said, what? 30,000? Can you imagine how many would have died on that journey across the Sahara? So it was a humanitarian crisis where young people didn't want to stay at home anywhere else but home. They all wanted to travel. So, we're top of the list in human trafficking. top of the list in terms of irregular migration out of the country. That was a signal. That's why we had to begin to, by the time we started repatriating them and getting the data and trying to understand the root causes, we just realized that it was because the educational system had broken and these kids could not see a future. The other thing we had to do, and I believe the rest of Africa must do, was to get, to achieve the level of growth we need, we must invest in infrastructure. And two critical infrastructure, beyond roads and bridges, is power, electricity, and digital. We are lucky because of the location of Edo State. We are right there at the core of infrastructure in the country. And so we're the cheapest point to generate electricity because we have both the transmission grid and the gas grid running across our state. So today we account for almost 12-13% of the power in the national grid. But more importantly, we have gas, onshore gas, and we've been able to encourage investments to produce power. So we have IPPs running most of our services in the state. But the thing that's significant we've done in the last 3 years, we have built almost 2,000 kilometers of fiber across the state, connecting the state, such that we now have adequate infrastructure to deliver government services across the nooks and corners of the state. We're just now currently building an additional 300 kilometers to connect schools and primary healthcare centers so that we can deliver services, remotely. We can deliver telemedicine services to, our kith and kin in the rural areas. And lastly, so there's so many things government is expected to do, but you can't do everything at the same time. So you just select what are those key things, key activities that are catalytic. And for us, it's manufacturing, because you've got to produce what you consume. This dependency on the outside can't sustain us. And fortunately, since we have sufficient or adequate energy resources, particularly gas, so why not, sweat these assets so that you can generate enough power to have competitive manufacturing. So it's about your people, so that you don't have to import people and you don't have to import power. And the other thing that makes us really, really unique as Edo is our culture. We're the home of those bronzes that are being contested globally, the home of the Benin Empire. And nobody else has that. And we're saying to ourselves, here is a huge economic opportunity. So if we get back our stolen artifacts, we can now begin to explain to the world the civilization we had that helped build what we built before the coming of the Europeans. And that is something we can sell, which is unique. So we're focused on that. And so let me just quickly try and round up, since I have 10 minutes. I've talked about manufacturing. We've talked about, the investors that have been attracted, trying to use things, use what's available, particularly cassava as energy sources. We've, talked about, how we've encouraged people to come and invest and come and produce, particularly small businesses. They need, locations, they need power, they need policy to support what they're doing. And talked about, culture, where we have now designated a whole cultural district. We're building a museum for West African arts. We're a very active archaeological site. As I speak, thanks to the support of Oxford University and a few others. And hopefully, before I leave office in November, would have completed the first phase of this museum, which will serve as a storage facility, which will serve as a storage facility for collections. Like I said, we're currently doing a lot of archaeological work, and we've worked with the Benin Dialogue Group to help support the activities to make sure that Edo, Benin City, becomes a hub for culture in West Africa. So, to conclude, I said first, governments in themselves cannot accomplish much. They have to accomplish what they've set out to do, working with citizens. In Edo, we have prioritized strategic partnerships. Everything we've done, everything we've achieved is based on how we've created an environment to work with partners on a strategic level and on a strategic basis. And this is how we've driven the work that we've done today. So whether it's in the area of technology or skills development, that's the array of partners that we've had to work with across board. Whether it's in education, in the area of agriculture, finance, banking, we're very big with international donors. In manufacturing and small businesses, in arts, culture, media, in healthcare, in infrastructure, in construction, and others. So you can see there was no way as government we could have achieved what we have achieved if we did not create a template and create a structure to work with the private sector and the multilateral and other type organizations. So it's about partnerships. And therefore, if we're going to chart a new path for Africa, we must now organize our governments at a national, subnational, and sub-subnational levels. The priority number one must be what we're doing here. As you Africans must be trained. We must train ourselves, train Africans, both abroad and at home, to acquire, skills and excellence. You cannot survive or exist in today's world or be sustainable without technology. Not technology for itself, but technology to take us where we need to go to. And lastly, in doing all of this, we must never forget who we are. We are Africans. And our goal must be to let the world know that we are like any other groups in the world. Thank you very much.
All right. Thank you so much. I'll call you back, Governor, just to come and we'll have a conversation with you. If you can just come back upstairs and we can have a conversation. Yes, we'll sit together and talk through. Is the Slido up for people to ask some questions? Yes, I'll just sit by your side. Perfect. All right. So while we're waiting for the team to put the Slido up, that was a very insightful conversation that we had there. You talked about, the paradox that we have having a young population, a surge in youthful population. You also, talked about the oxymoron of how we are so rich yet so poor, but you also encouraged us to, utilize our competitive advantage of, using manufacturing, using our culture. So all those are great things that you brought up in your talk. So if any of you have questions, please scan the Slido and put your questions out there. But Kennedy, coming from the same state, what did you think about that conversation, that talk?
Oh yeah, I was pretty impressed by how you talked about the flow of migration within those states and the problems with Libya as well. I think a question that I have in focusing on that is that knowing that Edo State, in some ways and opposed, will lead in human trafficking, and also the dire conditions that are apparent in terms of migration flows. What is the government and with you in leadership doing to, in some ways, curb that at the point where there is this narrative that for you to find development and for you to find human mobility and growth, you need to go to Italy or you need to go to Libya, and people take that dire risk in crossing the Mediterranean. And so how is Edo State becoming a front runner in terms of dialing that back a bit?
Yes, I think that's the purpose of my talk. That in 7 years we've reversed that trend from Edo State being the leading state in Nigeria, where young people just emigrate from, to 7 years after, where we are not top 10 anymore. Where we've seen a situation where people no longer want to go out. People are now heading back home because we've created an enabling environment, much safer environment, opportunities for young people. We have this agency, the Skills Development Agency, Edo Jobs, that has either mentored, supported, skilled, and placed almost 200,000 young men and women in the last 7 years. And so the situation we have today is, rather than seeing, migration out, we're now seeing a lot of migration in because people are coming to look for opportunities. Thank you.
Thank you so much, Governor. Earlier today we were talking about integrating Africa, and Honorable Raila Odinga talked about how he's running for the AU. So there's a question that has come in for you saying you have done great with international partnerships, but what are you doing to promote local partnerships and investments?
I think there's been more local partnerships. Fortunately, I have some of them here. Take our whole reskilling of the civil service and public service. What did we do? We had to call in experts. I have Joaba DIA. Okay, he has international experience. Our partners here, but he's local. He's in Abuja. Himself and his team have come in to help us work through a whole training program for our public servants. We have the John Odigeregu Public Service Academy, where we retool and reskill our public servants. Most of our technology implementation, the H.E Gov platform we use in Edo today, because we're a paperless government, was developed locally. The ERP was developed locally by local partners. I can't recall, except for multilateral organizations like the World Bank, I'll say most of our initiatives, most of the support we've gotten have been local.
All right, so we'll just wrap it up. Maybe you could just give us some concluding remarks on this. You've told us about the Edo model, which sounds great, but how replicable is this in other places as well?
So that's what I'm saying. What's the model? The model for growth is you have to focus on government. You've got to retool and reskill government. And in doing so, you've got to get the people who run government, us politicians, bureaucrats, to begin to think differently about the services they offer. That government does not act for itself. Government does not exist for itself. Government exists for the citizens. So the government cannot be seen to have done well if the citizens are not doing well. Because that's the first, and I think it's replicable across the board, whether it's local, whether it's state or federal. The second, which is a corollary to that, is that government is about people. It's about solving people's problems, solving the citizens' problems, making sure citizens are educated, they have good health care, they have water, and whatever else they need to live happy lives. And to do that, you've got to train people. You've got to build their capacity from birth. In fact, what's most important is focusing on basic education, foundational learning. Right? It's great to be here, to be in Oxford, but if you didn't have strong, foundational learning, you won't be here. So you see how many more people, how many more Africans we can create if we just focused on foundational learning. And then also skills. To say, look, you are educated means that you can help yourself. You can feed yourself. You can use your hands, not looking for work or working businesses someone else from some parts of the world have created. And then lastly, that everything you need to live, everything you're looking for outside the rest of the world, you also have. Just look inwards and use your hands.
Oh, beautiful.
Right.
Use your hands indeed. Thank you so much, Governor.
Right.
Thank you so much.
Okay, His Excellency Godwin Obaseki, thank you for your grace, for gracing us with your presence, for your discourse on human capacity in culture and agriculture. We welcome you to Oxford and we wish you luck in your tenure. Thank you.
Thank you.
All right, another round of applause for the governor as he makes his way down. Amazing, amazing. So we are moving on to the next part of our program. We have the Vice Chancellor in our presence. So the Vice Chancellor will be coming up to give a speech. And after she gives her speech, we'll go straight into the pitching. So for the people pitching, please be ready. Immediately the Vice Chancellor gets down, it's your show. But Kennedy, you've worked with the Vice Chancellor before.
I think she's amazing.
Oh, really? Is that so?
But she's a woman who doesn't need as much introduction. She's everywhere. Just always with the MCRs. I don't know if you're familiar with Oxford terms. MCR, JCRs are middle common rooms and junior common rooms where we associate with our colleges. She has been a proponent of climate change and adaptation and sustainability in Oxford, but also she has worked well with EDI in terms of promoting equality, diversity, and inclusion. So with no further ado, I welcome Irene to the stage.
All right.
Thank you so much. That was a very generous introduction, and I'm absolutely delighted. To our distinguished guests, Your Excellencies, it's absolutely fantastic, and your associated teams, a very warm welcome to Oxford. Thank you for making the time to be here and to be just so inspiring to our faculty and to our students. We're absolutely thrilled and honoured that you have taken time out of your very busy schedules to be with us. So thank you so much. And can I start by congratulating the University of Oxford's Africa Society for pulling this whole wonderful conference and event off. I can promise you they are, well, as with all our wonderful students that come from the continent of Africa and the different countries, they are unbelievable and just our proudest product. And they have done your countries proud by their diligence, their fortitude, their unrelenting resilience in trying to extract money from us to make this conference happen. I was so thrilled. As part of the theme was innovation, I tested them about how you need to learn how to raise funds, and it's a good lesson. And wow, they really rose to the challenge and did fantastically well at getting contributions from, as you can see, the list of people here, some of which are internal. So again, my gratitude to Oxford University Innovation and to Oxford Science Enterprises, but a really big shout out to those students. You've just done fantastically. I'm just sorry that this is midterm and it's a very busy time at the moment for a whole host of reasons for me. So I'm unable to be taking 2 full days off and enjoying the conference, but I know that you are all enjoying it, and it's wonderful to be here. Again, thank you to Rhodes House and to Elizabeth Kish, the warden of Rhodes House, for hosting us in this beautiful new building. So with that prelude, what would I like to say? Well, I think maybe to illustrate the importance of the relationship that we have with Africa, the importance and the value we place in the networks, the collaborations, our desire to work with you as we take on some of those global challenges, whether that's climate change, whether that's around health, which of course has been long-standing through our collaborations. All these different ways that we have wanted to, are continuing and want to do more, I think are illustrated by the fact that for the first year this year, in our annual awards, we decided to create a new category, which was a category that was the Vice Chancellor's Award for Outstanding Achievement. And that is an award that I can personally pick out of the hundreds of applications of teams that came from all the divisions of the university: humanities, social sciences, medical sciences, physical sciences, our gardens, libraries and museums, people who are in the academic side or the professional services side. And out of all those thousands of entrants and hundreds of teams, the one that I picked was, of course, the Oxford Programme for Africa, AFOX as we refer to it, because it exemplifies everything that I'm most proud of in this university. The capacity to work, again, with great resilience and tirelessly to achieve that purpose and that goal, to work across all branches of the university. So the extent of how they have collaborated and supported and benefited all of our divisions and all aspects of the university, from undergraduate through to graduate through to collaborations. The facilities that they have created and the wonderful mentorship that they give when we host students and now faculty. I have been subject to their persuasive powers too, in my former role as a head of one of the colleges here, in hosting an extraordinary individual, Professor Stephen Kennedy, who came from Liberia and led the Ebola outbreak charge for that country. And what a privilege and honor it was to host him with us here in Oxford in the medical school and in my college for 6 months. So AFOX won the prize, and I think that illustrates again just how valuable we appreciate, and again the very clear presence that we have in terms of our aspirations going forward. Now, this meeting is largely around innovation, and that's something else that we're very good of. I'm not going to go into a long speech about all the wondrousness of Oxford and all the different things we do around our core mission of course, teaching and education, which, of course, is such a huge platform. And again, we wish to continue to develop our graduate scholarships and our programs, whether it's through the Rhodes Trust, the MasterCard program, so that we can be that educational home for students who wish to come and study with us and have the wonderful diplomacy exchange that brings those cultural exchanges between our countries. I'm a very, very passionate supporter that a great role of the universities is not, of course, just to deliver that education and that research taking on the global challenges, but it's to become this home for peoples that they can come from all parts of the world and enrich our environment here, to enrich the student experience from all those different countries, and to learn from each other and take that back. And that's an important and valuable part of that soft diplomacy that all of our great universities, whether in Africa or over here in the West, we wish to, again, remind sometimes our governments about the important role that we play in that regard. This is a wonderful fulcrum and crucible for young people to come and learn about tolerance and inclusion. And it has to begin when they're young so they can take it forward. So again, I will continue, as mentioned, championing my desire for Oxford to be an ever inclusive place, and to again facilitate for those who do wish to come and study here, that there will be no barriers for them in terms of their ambition and their aspiration to come and be with us. Now, in terms of the innovation piece, this is something we talk less about, but I've been talking a lot more about this since I started in my role. I'm a scientist by background. I ran one of the clinical departments in the medical school, and I'm very, very passionate about the value that universities also can play in driving the economic growth of their countries through the engine room of our discovery, and an increasing appetite that I see from undergraduates, graduates, early career researchers, and our seasoned professors who want to take those translations and spin them out and create spin-out companies, to create licenses, to maybe have a career that's a little bit different to the conventional academic career, where they can go in and out more easily in a more porous way between the public university and the private sector. And we have to be facilitatory in the university sector for that model. So this is something, again, that we've done pretty well in Oxford. Just to give you a couple of examples, we spin out about 25 to 30 companies a year here in the university. Over 10 years, we've now spun out 300 companies as of last year. Apparently half of the venture capital money that came to the UK last year came to Oxford. And so we have a thriving entrepreneurial spirit in this university that we are now, I feel, got rocket fuel in, and we're just ready to explode. And again, this is something that I have been talking a lot about in the past 18 months as I started my role as Vice-Chancellor, and I will continue to talk about through the remainder of my tenure, and put actions into words in terms of, again, supporting OUI, supporting OSE, supporting the other investors, the other founders, the local city and the region. The Governor just spoke about the importance of, again, working with local businesses as well as international companies to drive that local benefit to the community and to the country. Britain is at a very interesting place. We're poised, having now just about, I think, felt that we've recovered from the pandemic. But of course, we're now facing the reality of what it means to be Britain outside of Europe. And how does that look? What is our identity? How do we want to take Britain forward in this new, more isolated, if you like, but maybe for some people, a sense of more free way of operating? And the university sector has to be a major part of helping shape that identity, helping the country economically grow and prosper, because that's the phase that we're at a national level. And frankly, without the powerhouse of what is our strong higher education system, which I know you share the views in your own countries, we won't achieve that goal because we are that engine room of discovery. We've got this wonderful, constant, replenishing pipeline of talent that just arrives every year in the form of our new students. What a wonderful thing that is, if you think about it as a company sort of term. And they're coming through and wanting to have the opportunity to develop their entrepreneurial skills. And we are hopefully increasingly meeting that challenge, whether that's through our Inspire program or our Ideas program, where again, we're particularly targeting some of the community who feel that they are not getting access to venture capital funding or investment. And we know that that's particularly problematic for women founders. The statistics are dreadful. If I'm honest with you, it looks a little bit and feels a little bit where academia was 30 years ago in terms of gender balance in that regard. So all of these things we're trying to address, we're trying to change, we're trying to inculcate an environment and an ecosystem in the university that facilitates that desire and appetite and thirst for entrepreneurship and innovation that I see in our undergraduates, graduates, and in our faculty and in our non-professional services staff. And working again with the local community in a more coordinated way, we're really hoping that we can build something here around Oxford in terms of our innovation ecosystem that truly will be spectacular. And I defy anywhere in the world to beat us. I accept the challenge from your countries, but you know, let's work together rather than in competition. So that's just a little bit around the innovation. And then so I was particularly thrilled to use some of the funds that I had to support the competition that you're having. I'm very excited to know how those results will play out. And whatever else I can do, again, working with the University, Africa Society, and with the AFOX program, I will do everything I can to support the ambition that you have and the aspirations that you set yourselves. And I look forward to hearing the outcomes of your deliberations at the end of the meeting when I catch up with the students and the team towards the end of term. So thank you again for coming to Oxford and participating in this event. Congratulations to the Society and the students for pulling this off. Thank you, distinguished guests, for coming here and spending your time. And I look forward to, again, developing and furthering and deepening those vital connections that we have so that we can collectively, again, take forward those aspirations about economic growth and prosperity for our peoples, but also use that as a vehicle to take on some of those great world challenges we have in the context of health and, of course, climate change. And with that, I'll hand over to the rest of the panel.
All right. Thank you so much, Irene. It was really great. So as you just mentioned, Irene is the People's Vice Chancellor. We were running a few weeks ago, town and gown, and she ran past me. So next year, I hope I'll pick up the pace and I'll run faster than she does. But yeah, so we're moving on to the next part of the program, which is the pitching. Yeah, people will come up and they'll be pitching. So this is the format for the pitches. It's 8 minutes. One group comes and pitches. Then we have 7 minutes of Q&A. Who's our timer? Can I see our timekeeper so that we know how we're doing in time? Can our timekeeper just give us a sign? Okay, thank you. So it's 8 minutes for the pitch, 7 minutes for Q&A. Kennedy, do you want to tell us more about? Oh, okay, your mic is okay. Okay.
All right, so here are the finalists. The first, the group one, they're going to talk on development, Mari test, and Somali refugee girls education. I don't know if you're any representative here, just come forward. And group two is the student-led research, smart irrigation system for sustainable agriculture towards an AI governance framework. And group three, entrepreneurship, cocoon creations, Kanisa Health. So if you all are in the room, you should probably get ready.
All right. Okay. So in case anybody is wondering what this pitch is all about, so it's the 3 groups that have been announced have innovative ideas that will benefit the continent. So let's engage for the 8 minutes when they are pitching. Let's give them the attention. Let's listen. Let's think through the questions so that we fire them with those questions during those 7 minutes of Q&A. So ready when you are, I guess.
Hello. Let's assume I asked you to account for what you did in the previous 1 minute. Perhaps some of you might say you checked on your email or said hi to your neighbor. What if I told you in 1 minute a child below the age of 5 has died from a preventable and curable disease, malaria? This is the harsh reality of the burden caused by this disease, especially on the African continent. All protocols observed. My name is Kikuza Hakim. I'm the founder of MariTest, and we are inventing malaria diagnosis at the tip of your finger. My journey with malaria started from a near-death experience, whereby during my school internship on a remote island district in Uganda, I got infected with the disease. Unfortunately, the nearby hospital had run out of the diagnostic kits. This delayed my diagnosis and treatment. In 2022, out of 240 million people who got infected with malaria, unfortunately, almost over half a million of them died from it. 95% from sub-Saharan Africa. 80% were children below the age of 5. Why? Because they lacked access to timely and accurate malaria diagnosis. This is so common in remote communities of the continent. You may be asking, what's malaria? Well, malaria is one of the world's leading causes of death, caused by a parasite called a plasmodium, basically transmitted through a bite from an infected female Anopheles mosquito. It infects the red blood cells, the liver, and the kidney. It's predominant in tropical and subtropical regions like Africa. It has existed for decades. Lots of interventions have been made to make diagnosis accessible to the community. In order for us to understand what is being made, we did a survey on 100 health workers in 5 different African countries. Our survey unraveled that 90% of them use MRDTs, the rapid diagnostic test kits. Unfortunately, Sub-Saharan Africa alone has over 5 different species of the plasmodium, and these rapid test kits can only detect 1. The 10% that use microscopy informed us that it's hard for them to detect the disease on the initial visit, necessitating patients to make multiple visits to the clinics. And you can see in the red the cost of this diagnosis. We're talking about a continent where majority of the population lives below $1. This is greatly limiting their access to the diagnosis that they need. Furthermore, the existing diagnostic tools are single use and they generate tons of medical waste that could breed new diseases. It's clear that we need an effective, innovative, and environmentally responsible solution. Colleagues, it's my pleasure to present to you MariTest, a bloodless, automated device that integrates artificial intelligence and advanced biosensor technology to diagnose malaria. When you get infected with malaria, the parasites infect the red blood cells. They digest the hemoglobin from it to produce hemosins, a substance with magnetic properties. We designed MariTest to leverage on the presence of these magnetic properties to be able to give the malaria diagnosis. It has 3 main features: the biosensors, the AI algorithm to analyze the magnetic waves from the sensors, and reporting real-time these cases for monitoring and surveillance. So for a patient, they'll simply place their hand onto the device. This device will detect the presence of the hemosins, the red blood cells, and the blood pressure. Within a minute, send them to the AI algorithm, and they're able to get their diagnosis. This diagnosis is shared in real time for monitoring and surveillance. This could be used by University of Oxford that is making a vaccine for malaria. So our goal is simple: to reduce the deaths and complications from malaria by providing a quick, accessible, and accurate diagnosis. The global market for malaria diagnostics is projected to be at $1.1 billion by 2029, with 88% of this market being in Africa. We are targeting 44% of that, and we hope to cover a 10% share of that market. So far, we have conducted 76 trials in Uganda, achieved a 60% accuracy by comparing our device with the traditional methods. We operate a B2B business model with hardware as a service, whereby we have 3 subscription packages. Our first package is $80 per month, and this is for hospitals that have a volume of around 500 patients. So this could bring the cost of each test at only 16 cents, which is 92% cheaper than the cheapest option of an RDT. Our go-to-market strategy is in 3 phases. Our first phase is the pre-launch, where we'll be onboarding 100 hospitals with a 2 months freemium. After that, we'll launch to cross over these hospitals into a premium subscription, and later on, we'll scale to 1,000 hospitals. In 5 years, we project to cover 0.5 of our target market, generating a total revenue of $9.9 million with an annual growth revenue of 1.9 million. Our biggest competitor right now is the MRDTs, but we stand out as being the most reusable, a device that can quantify the severity of the disease, and it's not prone to mutation as the RDTs are. We're not the only people looking at the future of non-invasive technology. In fact, Yale University, Johns Hopkins has designed devices, but we stand out in terms of usability, affordability, and scalability. We designed this for Africa. In 2023, I assembled my team. We raised $3,000. We did our first prototype. We did our technical trials. We learned that our accuracy was low. We went back to the drawing board, and right now we have a new improved device. Our ask tonight is £5,000. That is going to enable us to develop our AI algorithm and conduct more technical trials. We also ask to be incubated in the University of Oxford Incubator Program for more technical support and mentorship as we continue to develop more tests. After this, we hope to raise $100,000 for our clinical trials next year. Upon receiving the funds, we'll manufacture 10 devices, do our data set collection, develop our algorithm, and submit our device for clinical trials. I'm happy to lead a team that represents Africa. I'm the founder, a certified project manager. On my team, I have a medical doctor, an electronics engineer, AI engineer, product designer, and 2 financial analysts. For skills that we don't have, we have an advisory board of experts in health tech, researchers on malaria, community intervention specialists working with the Malaria Youth Corp, 2 business consultants, and we're partnering with the University of Global Health Equity for our clinical trials, Malaria Youth Corps for our community intervention, Futurize, Fundibots, and African Leadership University for as we continue to develop our business. Malaria is not only a health burden, it's a society burden. It contributes to over 50% of school absenteeism in sub-Saharan Africa. Malaria is not an African problem alone. 3.3 billion people, that's almost half the world's population, are at risk of getting malaria by 2030. With climate change fueling the spread of mosquitoes in new areas like Italy and UAE, means this could happen even quicker than what was projected. And the biological threat from the mutation, it's making existing technologies like MRDTs not effective enough to diagnose this disease early. Concluding my pitch today, approximately 8 children have lost their lives. This is the future of Africa being cut short. But worry not. We not only have the plan, we have the solution to end this. I call you now to join us as we end malaria, so that the next time you plan your trip to Africa, you don't need to go through weeks-long of pre-malaria treatment to experience the beauty and diversity our continent has to offer. Thank you.
Thank you so much. Thank you so much. So we have 7 minutes of questioning, and I'll pass the mic to the judges. If they have, the first people to ask some questions, I'll just pass the mic around.
Sorry, maybe before the judges, is my team online? They're connecting online. The rest of my team. Yep. Thank you.
You talked about wanting to get support from places like the incubator here in Oxford. What do you think that could bring to you that you don't already have?
Thank you so much for that question. We are navigating this journey of using AI into healthcare. I have an AI engineer on my team, but not yet skilled yet in AI since it's a new field. So we hope to get more technical support in terms of us creating an AI algorithm to be more accurate, and also support in us developing a data set for the AI development.
Is this working? Yeah. It was a very clear presentation. Thank you. Can you talk a little bit more about what you're actually going to use the AI for and what data you're going to be using to inform it? What specifically is what aspect of the problem are you deploying the AI against?
Okay, I don't know if my AI engineer can join us right now. I don't know if the tech team. Okay.
I think we're having just a few technical difficulties.
Okay. Okay, I'll take it on. So I wanted our AI engineer to be able to answer that, but we're using, because when we did our first trial, we're basically using machine learning principles to give it like a range of values that it could detect. So the magnetic waves create a certain pattern of values. So we gave it values that it could detect. And because when we didn't give it enough data, it was giving false negatives. That's why we had a 60% accuracy. But when we use AI, we can give it lots of data and give it more power to analyze the variables for the three variables to be able to give an accurate diagnosis. And why are we using AI? Because in Africa, besides these diagnostic test kits being scarce, we have a scarcity of medical workers. Africa currently has a deficit of 2.5 million health workers. So when we use AI, we are going to be bridging that gap. That AI could perform this diagnosis for the doctors so that they focus more on providing the healthcare that. Yeah, so that's how we're going to say. Thank you.
Very great presentation. I like it because again, I'm from Nigeria and I can relate to the malaria problem. It's very huge, like where I'm coming from. I think my biggest concern would be around the hardware device, because like when can you scroll to this the slide about your business model? You had mentioned that it's hardware as a service, it's a subscription product. I think I just worry around like how much does it cost to like produce? Do you have an idea how much it costs to produce the hardware device? Do you think that like at scale, like you can make enough money to make this a sustainable business?
So we haven't yet come up with the actual price because we only did prototypes and sometimes they're expensive. To do this prototype that I was holding in my hand, it costed us $200. But we hope that if we reach at scale and then we're into proper agreements with the suppliers of the technologies that we use, this could go down. Yeah.
Okay, I saw three hands. I'll start here. I saw your hand, Tinashe, at the back. I'll come to you, but I saw a hand here. This was a hand.
I thank you very much, and I thank the university, Vice Chancellor, and the team for hosting us. I cannot catalog the number of times I've had malaria infections. In fact, the last one is 2 weeks ago. So we live with it. It's part of us now. But again, we realize that certain times it has a way of hiding within the blood cells, that you do lots of tests, but you cannot detect it, especially when you are also suffering other bacterial infections. So it has a way of hibernating. But I'm glad that you're coming up with a very simple method which can be domiciled at our homes, and each time somebody gets an affection or infection, you have a recourse, because that is what is lacking. Now, at the moment, you're talking about 60% certainty in terms of detection. So what is this that you'd want to infuse? I have seen the amount of monies that you'd want to put in furtherance of more advancements. But what is this that you'd want to put in so that we can have 90% or 100% certainty after doing the tests. Because again, we wouldn't be very interested in getting a machine that has only 60% positive variable. It may not help us very much. So I would want to understand what you're going to put in so that we have 100% certainty. And I thank you.
Thank you so much. Thank you so much for the question. So why we are putting into this device, this new iteration that we made, is the ability to use AI to diagnose malaria. So we have incorporated in a system on chip that will run the AI algorithm as it detects the plasmodium. As you place your finger onto it, it has this AI algorithm already onto the device. So it's able to detect. So the algorithm improves the accuracy because we're going to give it lots of data sets from lots of data sets around malaria. So we're going to test people with malaria, get the values, get their values of positive people, and use that value as data set to train AI algorithm. So it will be more accurate. And also making it able to report these cases in real time. So we are touching on a GPS and a GPRS to be able to locate these cases in real time. One important lesson I think COVID taught us is how data is important in fighting huge pandemics. So if we imagine we had data that, let me say in Nairobi, there are 100 cases of malaria today, then government, if through the partners, could have a more data decision initiative to combat the malaria in that place. So that's the future we're looking at.
All right, thank you, Hakeem. So I've been very mindful of time. We're keeping it really short, but there's been a hand that's been.
Yeah, thank you. I just want to take you back to the very basics, knowing where you're going to apply this technology.
Yeah.
You've not told us how this thing is powered and how it communicates, because you're taking it to the rural areas where coverage of, electricity connectivity and even communication coverage is a challenge. And why would you situate it at a health facility, knowing that those facilities, first of all, are few and far between, and they would require people to go to those places? If it is as small as I saw it, it should be mobile enough to be carried around by the community health workers.
Thank you so much, Senator. I think, sorry. Okay. So yes, let me just go through it. So why are we, so you mentioned about the location you are designing it from, yeah? So we designed it to be able to be charged by solar power, to be charged by solar. It only uses 5 volts. Any solar panel can charge it up. It's like a mobile phone. Yeah, it's like a mobile phone. So it can be charged easily using a solar panel. And then about connectivity, right now we are looking at using the internet, using a SIM card internet, but these are some of the things that we want to learn during our clinical trials. Some of them we haven't tried them out, they're just the things that we have. So around connectivity, we'll be able to test that out during our clinical trials. And in regards to clinical health workers using these devices, instead of hospitals, that's why we designed it this small. One of the feedback we received from this initial design, sorry, it's failed. But our initial design was a little bit big, and we envision, because we not only want to work with hospitals, we also want to work with the community workers. So for a community health worker to walk around with that device, it will be hard, but that's why we designed this one to be able to fit in their pocket, that when they go to your house, they're able to provide that diagnosis at just your doorstep. Yeah. So we haven't yet run that test, but should be able to hold like for a Friday or two.
All right. Thank you so much, Hakeem. Kenneth, do you have a pressing question at the back? That's the last one we're taking.
So
for
the
this
final
session.
question. And
Thank you for the opportunity. Like your device is based on magnetic measurements. So I'm curious as to, is the malarial infection the only infection that would give blood those magnetic properties? Or there are other infections that could give rise to the same magnetic properties that are trying to measure? So it's sort of like you're doing a surrogate measurement instead of a direct measurement of the infection itself.
Thank you so much for that question. From the research we did, Right now, to the best of our knowledge, it's only Marilla that gives out those magnetic properties. But this is also something that we want to study during our clinical trials. Before we put it out to the market, we want to also study it in our clinical trial phase. Yeah.
All right, Hakeem, thank you so much. All right, that was Hakeem. Thank you so much, Hakeem. So for the next one, we'll be very strict on time. Lauren has even come to the front because she was at the back and I was not seeing her. Now she's on the front row. So it's 8-minute speech in Q&A. So for people asking questions, just keep it brief, short and sweet like me. Keep it brief and then, we move. Yes, so is the second team ready? All right, the second team, please come up. We can give them a round of applause as they are coming up. Thank you, thank you.
Thank you. My name is Hamdi. I'm one of the students at the University of Oxford. I'm doing my master's in refugee and post-migration. I'm from the Dadaab refugee camps in Kenya. That's where I was born, brought up, and I have lived till today. That's where I received most of my education. I'm also an advocate for girls' education. I'm not alone. We are very many, the Dadaab refugee youth. And we are excited to pitch our project here, the Somali Refugee Girls Education. We come up with this project because I belong to the Somali community, and our culture is framed within the patriarchal systems, meaning that women and the girls have limited access to social services such as education and employment. So because we were born in that context, and we belong to the community and we understand the challenges of the Somali refugee girls, we have come up with this project so that we create a community support for them. The project, it's an extension of the community aid network, which is itself a refugee-led organization registered in the Dadaab refugee camps in Kenya. CAN actually was established in 2020, a time when COVID-19 had seriously impacted the activities of the humanitarian organizations that was conducting the humanitarian activities in Dadaab. And we had to chip in because we thought of maybe supporting our community both during crisis and the normal time. Our project, our Somali Girls Education project, is also in line with the Community Aid Network vision and the mission, which is now to promote and develop community-led initiatives for a lasting impact. The context. The Dadaab refugee camps in Kenya was established in 1991 by UNHCR in agreement with the government of Kenya when Somalia entered civil war. The initial plan was to accommodate 90,000 refugees, but unfortunately, Dadaab ended up accommodating more than that. In fact, as of 2023, Dadaab accommodated more than 240,000 refugees due to the subsequent wars that has been occurring in Kenya's neighboring countries, including South Sudan and Ethiopia and Congo itself. Dadaab has both formal and non-formal education systems because we are interested in the education sector. Currently, across the 3 camps, there are 22 primary schools, 6 secondary schools, 5 primary accelerated education, 9 alternative basic education, 6 vocational training centers. All these things, there are a number of organizations that are working, who are delivering these services. However, the refugee girls have challenges in accessing these services. Actually, when you look at now these photos, there are 3 photos. These are vocational training center. These are the formal education systems. This is primary class 7 in Ifo Hormuz, in Ifo refugee camp. And this is also secondary. There's some aspects attached to these photos. Before I came to the challenges, if you are able to observe here in class 7, we have a lot of girls. The number of girls are very many. If you look at here, we have only 4 girls, meaning that as they transition from class 1 to the next level, the number will reduce. Why? Because of the following challenges. Poverty. Unfortunately, And I'm sorry, I've not thanked Honorable Raila for hosting the refugees. But in fact, the Dadaab refugee camps in Kenya have no access to the right of employment and the right of freedom, which actually adversely impacted the refugee agency, especially women and the girls. So this has resulted now, it fed patriarchy, especially in my community. Because of the limited resources, we focus on the education of boys, because there is this a common saying within the Somali community that gabar ama gota kaga jirta ama hala guursado, meaning that a girl should either be married or in the grave. Also, poverty impacts other aspects such as child labor, and also negative cultural norms such as early marriage. There are so many Somali men who are coming from diaspora who look for wives from the refugee camps, and the parents, because they are desperate for income, they immediately accept, and girls may end up dropping the school. Poor quality education. In fact, especially the primary level, are refugees, meaning that they have no even teaching skills. They are not able to apply the gender-responsive pedagogy in class, which makes the school an unfriendly environment for girls. What are the solutions? Because these solutions are based on our understanding of the context. Community engagement in girls' education, access to quality education, providing incentives, creating conducive environments, mentorship programs. 5. But it doesn't mean that we are able to fulfill all those things. We have to focus on 3 things that we thought we can do. 1, community mobilization. We engage with the help of the refugee youth, because our project is depends on the refugee youth in Dadaab. We engage with the help of the community, of the refugee community, with the refugee youth. We engage the community in girls' education project, mentorship programs. We also mobilize a lot of Somali refugees, especially those who have managed to attain higher education, so that they mentor the young girls in the camp. Advocacy. We also engage with the humanitarian organizations based in the camp, so that we recommend and maybe negotiate with the approach of education, so that we inform their policies and how they conduct education. There are NGOs. Before I go there, sorry. If we are given the seed fund, we are planning to support the education of 500 refugee girls across the 3 camps. Dadaab comprises 3 camps. It's not only 1 camp. It's the Gahale, Ifo, and the Hagadera. And maybe to some of you, it may be a joking, but it's not, because we consolidate the resources of the refugee youth in Dadaab. We are the ones. Even the NGOs you see, they depend on us, because they can do any work. They cannot do any activity without us, without involving the refugees. Our team. Because our projects, they mainly depend on the resources of the refugee youth in Dadaab. So basically, sometimes it's funny, our projects, because you will see somebody working for another organization at the same time volunteering, because he belongs to the community. So we depend on our projects depend on the refugee youth, whether they come from medical services such as MSF, whether they came from education sectors such as Save the Children or LWF, they still work with us to make sure that we support the education of girls. Specifically, our project, our girls education project, we are 3 persons. Ayan, who is the project officer, Muhammad, who is the project coordinator, and also Muhammad, I'm also called Muhammad. I'm the project manager. So because of we never looked at, because we were brought up in a highly marginalized context. We went to refugee schools with no quality education, but we never accepted that to stop us supporting the refugee girls. And we are ready to work with the community. As you can see here, we engage community outreach activities. And this is our organization, the Community Aid Network. That's the organization.
All right.
Yeah, so thank you.
Okay.
Okay, so we'll pass it on to the judges for their set of questions.
Thanks, Mohammed. How much do you think it would cost to support the project on a per annum basis?
The project.
Yeah.
Actually, when we were making our assumptions and the conclusions, we made based on the seed fund. What we can do with that seed fund. And actually, 500 is a large number when you look at, and a foreign organization, especially those who are now operating in Dadaab, may not be able to operate with that amount. But for us, because we consolidate the resources of the refugee community, and we other people, we come from the community, we are able to execute the work with that money. So our assumptions is based on the seed fund.
Okay, thank you.
I also wanted to ask, like, the refugee community, like, how many